Dr. Tokunbo Olajumoke, a consultant and anesthetist, commends the wife of the president for the boldness to make the pronouncement about the State House Medical Center. He corroborates a speech that masses are at the mercy of cutthroat private healthcare providers. He's not the only one agreeing to this.
It's so terrible at that level. If we are talking about the ASU clinic, which I think should offer the best in terms of healthcare for the first family in the country. And now to now hear that that kind of a clinic lacks everything to function as a clinic. It speaks a volume about the total healthcare sector in the country. And I ask myself, if that can happen at Aso Rock Clinic, I wonder what will happen at the primary healthcare center in the remote parts of the country. That means the masses are left to the mercy of private healthcare providers. And if Aso Rock cannot guarantee what is necessary to function, then you can't ask me what happens at the primary healthcare center. And we have been saying this thing over and over that there should be a total overhauling of the healthcare sector in the country. At all levels, national, states, local government, our healthcare system is not functioning optimally. We have been at the center of discussion, most especially where we are working, even in Osun State. I've seen places where somebody will be convulsing, will be taken to hospital. He's the one that will still go and look for diazepam to abate the convulsion. And that's why mortality is on the increase every day and then. I think discovering this at this Aso Rock Clinic should be something that will open the eyes of the presidency and look at the healthcare sector critically. There should be total overhauling. And the center point is corruption. When monies are allocated, approved for something, by the end of the day, the monies are diverted to serve other functions against the sole purpose for which it was approved. So I would still say the bane of Nigerians' problem, including the health sector, is still corruption. Because monies are allocated, monies are provided for some things, and eventually, when it comes to execution, these monies are diverted and are used for personal purposes. The other way around, I want to look at that at best. I hope it's not a means to justify the frequent journey of the president to go and seek for health care in overseas. Because that could be used also as a point. That even in a place where we are working, there's even no syringe to take care of us. So how do we stay when we have a challenge? And that can be used as a justification for the frequent journeys of Mr. President overseas in search of health care. So we have to look at the pros and the cons. But the merit in that speech is that it should open the eyes of the presidency to the predicaments being suffered by the common man. Because if you can suffer at that level, we say Aso Rock Clinic doesn't have what it needs to function. So you can imagine what happens in the primary health care center in remote areas.
You can imagine a situation where gloves, the rudimentary stage of treatment is not available. This is pathetic and it should be corrected. There is need for a real overhaul in the sector. It pervades all sections because I even remember some years back when my wife was to deliver my last born, I almost lost her because after the delivery, we have to, she was bleeding, there were no facility to take care and I have to take her to a private hospital. But at the same time, I will put the blame squarely on public officers, those who hold public offices in this country. And that starts from Mr. President himself. We could imagine the situation where our president has not been able to be treated in Nigeria. And there is no reason why that should be. Nigeria has a huge resources in which a fraction of it could be used to equip our health system. For example, there is nothing stopping the federal government from ensuring that all necessary equipment and facilities are brought to bear in this country, including manpower.
Other opinions point to the frequent medical tourism, a signal that the health institutions in the country is deteriorating and must be immediately overhauled.
The National Executive Council are responsible for the failure of the health sector. And I say categorically that the money allocated for that clinic and for indeed all the health sector in Nigeria are being stolen. There is no doubt about that one. I'm sure that I can say categorically that our government are not prepared for, monkeypox or any pox for that matter. The only people that we can rely upon is the people, the real people who are either doctors or nurses or people in the community that can do their best, to curtail the spread. But for government officials, and on them lies that body. But, there's a limit to which a people can go. Because where people are doing human efforts to stop this or stop that, but in the face of a collapsed system, an epidemic, we can only pray that an epidemic, does not of a magnitude, of huge magnitude does not break out. But, as the saying goes, ever help those who help themselves. So, Nigerians, we should do what is right and not just think that just praying about it, we do the job. I think for once, we should address the question of health facilities and health-related facilities like water, housing, sanitation, particularly water.
From the streets, the people call on the general public and progressive-minded people to mount pressure on the federal government to address health care and the delivery across the country.
The buck stops at the decks of the presidents of the country. So you can't be blaming if money is voted for a project in a particular clinic and the money, there is no results. It is either the money has not been released or somebody has mismanaged or misappropriated the money. So the next thing to do is to carry out proper investigation and due diligence on how far the money has been used.
We don't have hospital rankings.
Professor Temitokpe Alunge is the Chief Medical Director of UCH Ibadan, Oyo State, Southwest Nigeria. He wants the federal government to conduct hospital rating system in order to standardize medical practice across the country. He also blames inadequate funding of the health sector.
University College Hospital 3 years ago started the Total Quality Management Department. The Total Quality Management Department does not look into clinical issues alone. The essence of this department is to look at the issues surrounding quality care delivery to a client. It could be water, it could be electricity, it could be attitude, it could be slippery floor, it could be anything. And so the TQM that has started in UCH has become a big department and an eye-opener. We've employed 22 statisticians who collate data on a regular basis, pointing out areas of our misgivings. If it's management error, it is pointed out on a weekly basis so that we know how to correct them. There should be a standard, like a standard organization of Nigeria. UCH is a member of this, standard quality care, unit in Nigeria. But again, unless you have a buy-in at the top, that is from the Ministry of Health, percolating it down, people who don't belong to this group probably have no obligation to provide quality in everything. But if it comes from the Ministry of Health, the Federal Ministry of Health, State Ministry of Health, and the primary health centers and local government, and it becomes a law that these are the minimum standards required or expected, then all of these shenanigans will stop.